Thank you for joining us on Coffee Break, brought to you by the Middle Alabama Area Agency on Aging, or M4A. M4A is a part of a network of 13 area agencies on aging that cover all 67 counties across the state. We are located in Alabaster, and we cover Blount, Chilton, Shelby, St. Clair, and Walker counties. We would love to find out how we can help your family today. For previous episodes of Coffee Break, feel free to check out our YouTube channel. All right, I think we've got the bulk of who's going to join us for the Zoom portion of this. So I think we need to go ahead and kick things off so that we can make sure we get everybody out of here on time. So we want to thank everybody for joining us. This is, of course, our coffee break sessions. This is brought to you by the Middle Alabama Area Agency on Aging, or M4A for short. We're a part of the Aging Network in the state of Alabama. So for anybody that's joining us live or even on down the road, that's kind of who we are and who we represent. And we will kind of go a little bit more over M4A and the Aging Network towards the end if we have a little time. But this is primarily an initiative brought to you by two of our in-house programs. That is the PANDA Project and the Alabama Cares Traditional Caregiver Support Program that we receive federal funding for. With PANDA, on the other hand, it's a grant that we've received to provide supportive services to those living with Alzheimer's and dementia, especially or primarily within the Shelby County region, so the central region of Alabama. Today, we're going to be talking about social isolation, and we'll go over the PANDA Project a little more and Alabama Cares, as well as many of our other programs towards the end. But for the most part, the bulk of this today, we will be focusing on social isolation. And so that's going to be presented by two of our guest speakers today. That's Well Connected, which is a COVIA community service, and Joy for All, which is the companion pet program that we're excited to kind of introduce everyone. We're actually a part of both of these programs as far as having some access, promoting, and trying to encourage our clients to utilize both of these as well. So so the two presenters we have Miss Amber Carroll, who is with Well Connected, and Jim Murphy, who is with Joy for All. So I do want to kind of go over some house rules before we pass it on over to them. As a reminder, Coffee Break, of course, is a webinar format. So we're recording this, but unfortunately for those in attendance, you can't really speak. You can ask questions through the Q&A box as well as the chat feature. We can try to get those answered for you. Feel free to ask those at any time, and we can kind of refer back to them as we move along. For those we are streaming this live on our Facebook right now, and we do monitor that as well. So if you have any questions, whether it's right now or later on down the road, feel free to leave a comment, and we will make sure that we get those answered and get a response back to you. So feel free to do that, and we will definitely, especially during the live version, we'll bring those up as well, even though you're not in here with us in the Zoom feature, but we will definitely get those answered. So without further to do or to go over, again, this is Coffee Break. This is session number 20. We have been doing these since the pandemic really first started. This year, we've cut it back to once a month, but we find that it's just as important, even if we're only doing it once a month versus twice a month. We really enjoy bringing this quality content to our viewers, and we hope that you really get something from both of these resources. So,
okay. And then I'm also going to need to share sound in a bit. Okay, so welcome everybody. Thanks so much for being here. My name is Amber Carroll. I am the director of a program called Well Connected, which I'm going to tell you about in addition to a couple of other programs as well. I'm part of a larger nonprofit organization called COVIA, and we are a nonprofit that predominantly works in the world of senior housing. I'm based in San Francisco, California, and our housing communities are all for seniors, and they are kind of strewn throughout the Bay Area. None of that is particularly relevant to folks in Alabama at this point in time, because what I'm here to tell you about are actually some programs that are accessible to people living anywhere throughout the United States. So today we're going to be talking about Connection, which is the prescription for social isolation. So let me move on from here. Now, I'm just kind of curious to think about, and I know we've got folks joining on the phone, and we've got folks joining online, and I'm wondering if you do have the chat feature option. If I can just ask you all to type in or let us know, how did you stay connected over this last year? I just did the math and realized that we just celebrated over last week a year anniversary, actually 2 weeks ago, of shelter in place orders happening in San Francisco. So it's been a full year since we've been dealing with this. So I'm curious as to what all of you have been doing to stay connected during the pandemic. And it looks like lots of folks are doing a lot of what we're doing right now, which is we're on Zoom, lots of phone calls and FaceTime. Great. So people are staying connected, and it looks like what most of you have done has shifted to connecting virtually. Social media folks are doing. I'm wondering if anyone connected to folks that they haven't connected to. Did this provide any kind of impetus to connect with people you haven't talked to in a while? I know for Marco Polo app, I've heard of that and I don't know what that is. So yeah, family Zoom calls. I know for a while I was like meeting for happy hour with friends on Zoom. We do that kind of stuff. So really shifted kind of our natural social beings to something virtual. Let me move on here. There's a doctor named Dr. Gene Cohen, and he is considered the founder of what we call creative aging. And I mention creative aging because the programs I'm going to talk to you about today really do fall into that creative aging world. And what he did was he put together this idea of a social portfolio. And those of you who are familiar with financial portfolios, right, the number one message for a financial portfolio is don't put all your eggs in one basket, right? Because if something happens, you can potentially lose everything. And what Gene Cohen said was the same thing for our social portfolio. Don't put all your eggs in one basket. And this was something we found with the pandemic, where an older adult might go to the local senior center for lunches, for activities, for all kinds of things. And then what happened when the pandemic hit was that senior center was shut down, and that left that person with not much to do because that person didn't have a very rich social portfolio. So this idea is that we need to do things individually. We need to do things in groups. We need to do things that are high energy. We need to do things that are low energy, because at some point in our lives, something's going to happen that's going to take one of these quadrants away, at least temporarily. And that's what we really saw with this pandemic, was it took away a lot of those for a lot of people. So it looks like what you all did when I asked that question, what are things that you did to stay socially connected? It sounds like you were doing things within these 4 quadrants. So I'm going to talk a little bit more about that. And like I said, I'm going to be talking about Well Connected, but I'm also going to be talking about another program and how to kind of use these things together along with other things in your lives to keep you socially connected and engaged. So these are the connection programs that I'm going to be talking about: Well Connected and Well Connected Espanol and Social Call. The things that are really unique about these programs are, first of all, they're virtual. All 3 of these programs are virtual. Well Connected and Well Connected Espanol are the same model of program, but one, as you might expect, is fully in English and the other is fully in Spanish. So these are virtual activity programs for older adults living anywhere in the United States. And what we consider an older adult is 60 and older. These are programs that are entirely designed by and for older adults. This idea, let me just say, even calling these things programs makes me a little uncomfortable because I don't really consider these things to be programs. I consider Well Connected and Well Connected Espanol to be a venue by which meaningful relationships can happen. So everything that happens on Well Connected and Well Connected Espanol is born by our community. So about 80% of our participants are about 80% of our curriculum is borne by our participant population. So we're looking for folks to not only participate, but if they're interested, also to volunteer for these programs and create content that's interesting to them. Everything we do on Well Connected and Well Connected Espanol is accessible by phone or online. And we'll talk more about accessibility in just a little bit. And everything we do on Well Connected and Well Connected Espanol is free of charge to individuals. I can talk about some options we have for senior centers and senior housing communities when those are all up and open again, which is happening. It's nice to see this light at the end of the pandemic tunnel. But these are the Well Connected programs. And this right here is really just a week in a life of the Well Connected program. I didn't include both of them here. Couple things I want to point out. One, this is a 7-day-a-week calendar, which means we have activities going on 365 days a year. So Christmas can be a challenging time. There's plenty going on Christmas Day to stay engaged and to stay connected. So that's one piece. The other thing is, I don't have the times listed on here, but we function pretty much all day long. Our groups start anywhere from about 7 in the morning Pacific time to about 9 in the morning Pacific time, and they go until anywhere from 6 to 8 o'clock in the evening Pacific time. So so there's just always something to engage in. Some of these groups are in red, as you'll notice, for those of you who are seeing this on screen. Some of our groups are available to senior centers and to senior housing communities as a group activity. This, we do charge a small subscription fee every session. And, if you're at a senior center, you could plug into Museums at Home, which is going on exactly right now, at the senior center, and folks could enjoy museum tours from museums all around the country. So all of these groups, though, the point of them is really about connection and engagement amongst people. So if you think about joining a group that sounds interesting to you, because really the topics are quite varied. So the thing is, you may want to join, for instance, exploration in watercolor because you'd like to learn how to paint with watercolors. So that's really the point of why everyone in that group is joining. But during that group, everyone is actually connecting and engaging with each other around that shared topic. But this isn't a passive program where you're just listening to information. So that is our current session. We're going to be finishing up our winter session at the end of April. So April 30th, we end, and then our new session begins on May 1st. So the new catalogs are out to the printer and they'll be getting in people's hands very soon. So I want to just spend a minute as we talk about programs for older adults, and we talk about virtual programming. It is so important to address accessibility. And Steve Ballmer, who used to be the CEO of Microsoft, had this to say: accessibility is all about removing barriers and providing the benefits of technology for everyone. Now, this pandemic has been fascinating in that regard. And what's happening all around the world is folks are jumping on Zoom. And Zoom is great, but for those of you who are calling in, you know how many digits you had to punch in to call into this webinar. This has been a real issue, and it's coming to the forefront more than it ever has about this tremendous digital divide. A couple of years ago, the Pew Research Institute did a study, and they reported out that something like 40% of adults over the age of 60 didn't have broadband access in their homes. Now, this isn't to say that people without broadband access in their homes didn't know how to use the computer, didn't know how to access the internet, but they were doing it in places like senior centers and libraries and places like that have all been closed. And there's a number of people who simply don't have that technology, that knowledge, that interest, or whatever else, and don't have computers and don't have tablets and don't have smartphones. So everything you'll see on Well Connected and Well Connected Espanol is accessible by phone, and it can be any kind of phone. So what we started doing when we decided to venture into more online programming, it was really important for us to make sure that all of our programs were not only accessible to people by phone, but also online. We really wanted to meet people where they're at and allow accessibility however it's most comfortable for folks. So we started when Well Connected started in 2004, we were a phone-only program, and it was about 2015 or 16 that we started launching into some online programming, and we didn't want it to be an either-or scenario. So we really talked to our community of participants and said, what are the needs? And mobility was a huge need. And we were always quite good at accessibility for folks who had mobility issues because everything was accessible by phone. The other things we weren't so great at. We started really making a lot of accommodations for folks who had vision impairment. All of our materials are available in large print. We also have super extra large print. We have Braille versions of our materials. We have audio versions, so folks can plug it into talking book readers. And we're really working hard at getting everything to be screen reader accessible and everything else. Hearing, we just didn't have a lot of accessibility around people with hearing impairment or people with memory impairment, and the program originally was only in English. So we certainly weren't meeting the needs of people who spoke languages other than English. So what we decided to do was to build our own platform. We are deep in the throes of doing it, and we're building a conferencing solution that meets all of those needs. So everything we do on Well Connected and Well Connected Espanol is accessible by phone, any kind of phone, or online. We're trying to address memory issues more, where we can call people into groups now. So if you look at that calendar, you'll see that it's a little daunting. There's a lot of things to do, and it can be hard to keep track of what's going on when. So if folks want to join a particular group, we can call them into that. And because it's linked to our database and our registered users, people are actually identified. So I know Jennifer's on this call. Jennifer, if you wanted to join Poetically Speaking on Wednesday afternoon, you would get a call at the start of the group, and it would say, "Hi, Jennifer, welcome to Poetically Speaking." So it's a familiar, it will acknowledge who you are and what you're wanting to join. If you want to call into any of our programs in and of themselves, it's a simple 2-digit conference code. So all of our programs have the same toll-free number, and then it's a 2-digit code to join. As I mentioned, it recognizes your name. And when we got funding to start Well Connected Espanol, we were able to make everything that people see and hear on this conferencing platform in Spanish. And this is crazy that this does not exist on any other conferencing solution in the world. So people in the Espanol program are getting everything they're seeing and hearing is in their native language. We are trying to build out closed captioning and screen reader accessibility. And then that other piece is it's totally customizable. So if we got funding to start this program in Chinese, we could make everything be in Chinese as well. So this is a frustrating process, but one we're really excited about really having accessibility for all people wherever they are, wherever their interests lie in regards to technology and abilities. So those were the well-connected programs. I just want to really quickly touch on our social call program. So whereas well-connected connects an individual to a group of people around a shared interest or topic, social call matches an individual with another individual for a weekly phone chat. This is a friendly visiting program. These likely exist in different communities in Alabama. And but as you know, the pandemic threw off any kind of live and in-person visiting. Before COVID hit, we actually had launched this program virtually, and we did that because we were listening to our well-connected participants. So many of them were joining us from across the country and saying, you know, I like the group idea, but I'd really love to have a person. And if you think back to that social portfolio of Gene Cohen's, this works really nicely with that. This provides live activity, or excuse me, it provides group activities, and it provides individual activities, and provides volunteer opportunities and participation opportunities. Right now, we've been really intentional about crossing over as much as possible so people have a richer social portfolio. And right now, about 70 to 75% of our social call participants are also engaged in well-connected. And because we launched this virtually as well, we're also able to leverage older adults to participate and volunteer. Lots of the social call matches are intergenerational, which is beautiful, but we're also able to leverage older adults to call other older adults in this program. So that's the social call program. And like I said, it's really a one-stop shop for both programs. So if folks are interested in joining us, we ask people to register as individuals. It's one registration form. You can join Well Connected and or social call. You can do that by phone. You can do that online at our website, or you can mail in a registration form. So really, however it works best. If you're registering for Well Connected, you'll be sent a packet of information, and that packet includes a current catalog of events, a participant calendar, and that's really the single source of truth of information. It has the names of the programs, the dates, the days, the times, and the access information to get in. The calendar is published in your time zone so that you don't have to do all that pesky math with all the different time zones. If you're registering for social call, somebody from social call will contact you to get more information, because what they really like to do is make great matches. And the director of social call calls it prescriptive matching. And when we're matching people from across the country, that's so much easier to do when you don't have the barriers of transportation and geography to contend with. So pretty much as soon as you register, you can get started pretty soon after. For social calls, we want to find that perfect match for you. We do background checks and all that kind of stuff because we want to make sure everybody is safe at all times. So that's really, it's a pretty simple process to join us. And then with Well Connected, you can get started right away. I just wanted to show a quick clip. I know we're running low on time here, but one of our most popular groups on Well Connected, and one that was replicated in the Espanol program, is a group called Gratitude. We've been seeing a lot of research around how effective gratitude is around mental health and physical health. And we've been doing this for a long time. I think we've probably been doing gratitude for about 14 or 15 years now. And so I'm going to just play you a quick little audio clip of a gratitude program just to give you a sense of what it's about. Whoops, sorry about that. I went to the wrong place.
And Stephanie, dear, how nice of you to be with us. How great. Happy to grace the group. Well, I'm grateful for a lot. I had a great sleep.
Whoops.
Is for being heard. We had discussed in several groups feeling invisible, and I love that in this group you can say what's in your heart and be heard. And I just feel so grateful that yesterday I had a friend hear something that was very difficult for me to talk about, and that I thought would stay the same forever, and get a little bit slight different perspective on it. And I feel free today. I feel like I could finally get past a stuck place of thinking because I dared to share and I got heard. And I feel like that's one of the greatest gifts that we can give each other. And whether it's hearing the positive aspects or hearing the challenges, that's what I love best about Senior Center, is it gives us time to be with each other, and everybody's heart is so open, and I cherish that. And so that's what I'm most grateful for today, among all the myriad of other things that make me happy. Well, Stephanie, that fills my heart.
So that's an example of a gratitude group. And I share that with you, one, because I think it's so lovely. But the other piece is just to really understand that it's a program really about engagement, and folks are sharing with each other. And this is such a great way to start the day. So gratitude this session, I think we have going on 16 or 17 times a week on the English program, and about 3 times on the Spanish program. It's such a popular group. And I realize now I am out of time. So I did want to give some time for questions. That was, so let me just end with putting contact information up here. And if folks have questions, I'm going to defer to the M4A folks, because I want to make sure that we get to hear about the companion pets as well.
I don't see any questions on our Facebook feed, Jennifer. I think we pretty much answered all the ones on here, right?
It looks like there's one question here from Tiffany about the calendar. And like I said, so the participant calendar we give to registered participants. So after folks are registered, we'll mail the calendar to them. We do have, although I don't have it for our next session yet, but an outreach calendar that we can send folks as well for an idea of things. And then you can access our catalog by on our webpage, which is covia.org/services. And it looks like Jennifer put our email in the chat. Thanks, Jennifer.
Awesome. Well, we thank you for that excellent information. I mean, that was quite the cherry on top there with that call, because that was heartfelt. That was very. It's amazing how simple even a phone call, what a difference it can make.
You know, that's a really good point, Jeremy. And I think about, throughout COVID, what everyone is trying to get tablets and get technology into people's hands as we talk about the digital divide. But, sometimes the technology we can use to connect is so simple. And we often tend to overthink things, right? Rather than just say, pick up the phone.
Absolutely.
So.
All right, Jim, you want to take over and share your screen?
Alrighty, I think you all can see my screen now, right?
Yes, sir.
Awesome. Thank you. And thank you very much for inviting me to share information about ageless innovation and Joy for All today. So we usually start our sharing with our purpose statement at Ageless Innovation, and that is to reimagine how we positively live and age together by unleashing the power of play. And as somebody who's lived in the senior care space for a couple of decades now, you all might look at that and say, that seems kind of unusual relative to purpose or mission statements that you hear in the senior and senior care space. But when you hear the origin story of our Joy for All companion pets, it'll probably make a lot more sense. So our flagship and sole line of business at Ageless Innovation is the Joy for All companion pets. I'd imagine that many or most of the folks on the call today are familiar with them. But just to give you a little bit of background, and I won't give you all the detail here relative to how we got to now, but the pets themselves is a pretty interesting origin story in that there was a new business group within Hasbro, the toy company, that about going on 6 years ago now had been charged with creating a new line of business focused on a non-traditional audience. And as you all are aware, Hasbro has hundreds, if not thousands, of different lines of toys and entertainment, mostly targeting children. And so it was with the consumer insight that with one of their existing toys, a For Real Friend, which was a furry robotic type of pet, that they learned that about 20% of purchases were actually people buying them for an older loved one. So with that consumer insight, that this team at Hasbro went and co-created with older individuals and their family members, their caregivers, an enhanced version of that For Real Friend, and created a new brand, that brand being Joy for All. And at first it was the launch of the robotic cat, which you can see on screen, and then shortly followed thereafter with a robotic dog. And that was in the 2016 timeframe. And as you can envision, Hasbro, with so many retail partners, really focused on the direct-to-consumer launch. And it was very much of a retail strategy. But I'd say early on, as they started to get consumer feedback, a number of different organizations in the healthcare space started paying attention to this. I was actually with United Healthcare in the Medicare division in an innovation role at the time I became exposed to the companion pets. And although I have to say I started as a little bit of a skeptic because my daughter at the time had one of the For Real Friends in her room, and that's kind of what was stuck in my head, as I started to sift through all the consumer insights and the consumer feedback that was occurring through Amazon and elsewhere, myself and others at different organizations in various parts of the healthcare arena started paying attention to this. And ultimately, it resulted in 10 plus studies being done in the first few years. And I'll go into that in a little bit more detail and what the findings were. Ultimately, that group within Hasbro left on a friendly spin out in 2018. And the last couple of years have really been years of growth relative to not only the retail space, but more so the healthcare arena. And I'll really focus on that in just a minute. So from a retail perspective, just as a little bit of backdrop, we are distributed through many different retail partners in the US, and as with most consumer goods, Amazon is our single largest distributor, but we also are available through a number of different types of retail partners. Additionally, we've expanded globally, and Joy for All companion pets are now available in a few dozen countries throughout Europe. So honing in on the healthcare impact and specifically the topic today that we're talking about, social isolation and loneliness, I'd say that the two use cases that really became prevalent through all the consumer feedback and then the studies that were pursued were both looking to provide a positive contribution towards solving two big problems in senior care. So as we all are familiar with, Alzheimer's disease and related dementias affects a large number of people, almost 6 million people in the US, and the 16 million family caregivers that are by their sides on a daily basis. We know that it's a huge impact relative to the billions of hours that Alzheimer's family caregivers spend in supporting their loved ones. And we know that there's a huge cost relative to not only the individual consumer and their family, but also to the healthcare system at large. So making a positive impact relative to Alzheimer's disease and related dementias is one use case I'd have you think about. The one that, and I'll expand a little bit more on the second one, spend a little bit more time on it, but as I think you're probably aware, and social isolation and loneliness, they were at epidemic proportions well before the pandemic. We view social isolation and loneliness as the epidemic within the pandemic, and that epidemic will be with us coming out of the pandemic. And I'd say one of the few silver linings relative to COVID-19 is that it really shone a light on a number of vulnerabilities in the healthcare system, and one of those being social isolation and loneliness among various different populations. And focused on the older population, we know that social isolation and loneliness are serious yet underappreciated public health risks, that about a quarter of community dwelling individuals 65 plus are socially isolated, and a little bit more than that report being experiencing loneliness on a regular basis. We know that loneliness is a serious health issue and that it impacts both emotional and physical health. One recent study reported that loneliness is as damaging as smoking 15 cigarettes a day. And loneliness is a risk factor for dementia, heart attack, and stroke. So you can see the kind of interconnectedness between these two use cases. And that loneliness results in a 45% increased risk of mortality. We also know that based on surveys conducted by AARP and a couple of academic organizations, that loneliness has skyrocketed during COVID-19. And in the 50+ population, it's actually doubled from pre-pandemic to when it was measured in October of 2020. So these are very cursory headlines focused on the primary findings of a number of different studies. At the top there is a statistically powered study conducted by AARP United Healthcare. It's the study I previously referenced. And admittedly, some of these are larger statistically powered studies, and some are smaller, more qualitative studies. And we have a white paper that provides a lot more detail, and the vast majority of these studies are easily found via Google. But I'd be happy to share that white paper if anyone's interested in digging deeper into any of these studies. But I think in looking at them, what you're probably extracting is the notion that regardless of setting and who conducted the study, it really comes down to two sets of key findings as it relates to those two use cases that I talked about. So the psychosocial benefits are really around reduction in loneliness, feelings of isolation, reduction in depression, helping to provide a sense of purpose, resilience. And then when you look at the population with Alzheimer's or related dementias, the additional aspects of it are mitigated dementia-related decline and associated behavioral issues, providing an engaging experience that calmed individuals without use of medication. So it's an alternative to pharmacological solutions. And as you can also envision, it reduced the burden of care for care partners, whether they were professional caregivers in a home or a facility, or whether they were family members. And so when we talk about the application and how we're distributing and partnering with various different healthcare organizations, to know that, and as I'm sure many people on the line today are familiar with, I'm gonna spend the most time here on state units on aging and the area agencies on aging, but there are other channels within the healthcare arena that have also been making use of the Joy for All companion pets for those use cases that I described. So the first one being long-term care, which is some of our earliest testers and adopters were in the nursing home, assisted living, and memory care communities, and we continue to grow those relationships. Medicare Advantage and Medicaid, and then, as I mentioned, state units on aging and AAAs. So from a long-term care perspective, you can recognize some of the national chains, but we also work with a lot of smaller mom and pop type nursing home, assisted living, and memory care regional players. From a Medicare Advantage perspective, beginning last year for plan year 2020, CMS, Center for Medicare and Medicaid Services, provided some additional flexibility through their guidance that allowed for benefits that were specifically targeted for chronically ill populations. And this was very innovative and very new, something health plans had been asking for a long time. And beginning in 2020, we had our first Medicare Advantage plan cover our companion pets approved by CMS. It is a footprint of a plan in Minnesota. We anticipate that it's going to grow over the years to be adopted by many other Medicare Advantage organizations, but for now, it's very much early days in the beginning of that type of adoption. Similarly, from a Medicaid perspective, while not the exact use cases I previously have highlighted, we also have some Medicaid decision makers, both at the states as well as when they've outsourced to Medicaid managed care organizations, where they've been purchasing pets to deploy through care management, case management programs for a number of different similar populations. And lastly, and most relevant to this group, is that beginning in the early days of the pandemic, we had a number of state unit on aging and AAA leaders step forward, really looking to achieve many things, but relevant to this conversation, to combat social isolation and loneliness, knowing that our robotic companion pets have a track record and could be one of the tools in the toolbox. We don't claim to solve for all, certainly, but recognizing that they're one of the tools in the toolbox, we had a number of organizations step forward, and Commissioner Jean Brown was one of the earliest to do so. And I think we're approaching now 1,000 pets being distributed in Alabama through primarily area agencies on aging. And I think the stories that we've had communicated back to us by leadership, as well as individuals within different offices sharing the impact that it made, has been extremely powerful. And we receive those from different organizations on a daily basis. And I'd say it's one of the things that our small team really appreciates and definitely is extremely rewarding for the team to see that on a daily basis. And then lastly, I was going to play a short video, if I can get it to function.
These are called animatronic pets. We have dogs and cats that come in a variety of different colors and shapes. We've put about 60 of these pets out into the communities to test them and their impact on social isolation and depression among older adults. Social isolation is a huge public health problem. And I don't think that we've quite wrapped our mind around it, but it's at the level of osteoporosis, diabetes, obesity, hypertension.
Olson began working with aging communities about 25 years ago, and he believes these could be the solution to senior social isolation.
I don't care if I have to pay $1 million, I will not give that cat up. It's something to come home to.
So just a quick comment about the video. It was obviously made in the fourth quarter of last year. We've continued to distribute pets through a number of different states, greatly surpassing the numbers that were presented in that video. And we know that similar to the interview that was Director Olson from New York, when he was talking about his original success in the pilot, that we know that Commissioner Brown has been an incredible advocate for this as one of the many tools in the toolbox, and know that she's had some great media coverage as well relative to the impact that's been made in the community. So we're very grateful for the relationship and grateful to share information today. So I'll be happy to entertain any questions.
I don't see any offhand either on the Facebook. And for those of you, Jim was referring to Commissioner Brown. Commissioner Brown, Jean Brown, she is the commissioner for the Department of Senior Services, which with our aging network across the state of Alabama, that's our kind of our parent agency that we all kind of work under. And so she's been a huge advocate for this program. The graphic that Jim showed with all of the organizations, Alabama was well represented across. I saw a lot of logos on there for many of the area agencies on aging and councils on aging across the state. So we personally have seen quite a bit of success here for just our agency in the central Alabama region. So it's a great resource. And if that's something even within our region, which would be Walker County, Blount County, St. Clair, Shelby, or Chilton County, if you have any interest, you can contact our agency and we can definitely kind of help get you back in contact or get you a companion. We do have some available that we could potentially get to you or for your loved one. Well, I don't see any questions, Jennifer. I don't think there were any on social media either. So Jim and Amber both, thank you guys so much for joining us today. I'm going to kind of wrap it up here with just a quick overview of our aging network. So especially, I think we have several attendees who are from kind of out of our region. So definitely want to make sure that we shed some light on M4A as far as the aging network as a whole, so that if you have any interest in either of these programs, you can get connected back to your local area agency on aging to kind of get those resources. So for us, of course, we are M4A, which is the Middle Alabama Area Agency on Aging. We just call ourselves M4A because it's a lot easier to say, rolls off the tongue quite a bit better. So that is our agency. We are located in Shelby County, or Alabaster in particular. So we're just below Birmingham, but we cover Walker County, Blount County, St. Clair, Shelby, Chilton. I think I covered them all. Basically the counties that kind of surround Jefferson County. And of course, Jefferson County, as you can see right there, just north of the center, they cover Jefferson County because their region is so large, but we have other agencies that kind of surround their area. Of course, we operate in all 67 counties. Our network is made up of 13 area agencies on aging. And of course, like I said, we're one of those, and we're about as center as you could get. And we cover basically the counties surrounding Jefferson County. Our overall mission as a network is aging, or helping to provide the supportive services to allow individuals to age in place within the communities of their choice. And specifically for our agency, our motto is assisting all ages at all stages. So we have programs that like I said earlier, that, we receive federal, state, local funding, but several of our programs are able to provide supportive services to not only individuals who are what we consider to be a senior. So we do have, supportive services, like I said, at all ages, so that we try to provide those supportive services really for any family. And we're really just a really good starting point that even if it's a service that we can't provide in-house, we're more than likely going to be able to connect you to a resource within the community that can. Again, the counties that we cover: Blount, Chilton, St. Clair, Shelby, and Walker County, with Jefferson County being, we do cover that county for our senior employment program. The way the process works is we have an Aging and Disability Resource Center where you can either call in. We have it set up now to where you can go online and kind of fill out an application or a referral to have one of our ADRC staff members follow up with you to do a full benefits screening. And then that's really how the process starts. They are the kind of the entry, the single point that we use to really get the ball rolling to see what services might be available for you or your family member. Again, you can do that online as well. As you see here, there's a little box here. If you go to our website, www.m4a.org/referral, there's a button here where you can make a referral on behalf of someone else, as well as make the referral on behalf of yourself if you click Get Help. And it will kind of walk you through a questionnaire for you to fill out the information that you're inquiring about. And again, that's really how things get started. These are some of the core services that are provided throughout the state, many of which, most of these in particular are housed within our building here. Some of the agencies, it may be through a separate wing that's located in a different location, but primarily most of these services are in-house, with the exception of our legal assistance through our elder law attorney. But we provide anything from homebound meals to caregiver support services, to prescription drugs assistance programs, to insurance counseling. We have an expert who will look at your Medicare, especially during open enrollment, look at your Medicare plans to make sure that you're getting kind of the best coverage for your area. And she does that from a non-biased approach. So that's always great. Again, we have the senior employment program, legal assistance, elder abuse prevention. We always have ongoing training webinars and online formats similar to Coffee Break, where we're bringing attention to elder justice and kind of to help combat that a little bit, as well as our long-term care supportive services in the Medicaid waiver program, which is more of a long-term care service that provides in-home services to delay or prevent long-term care placement, like in a nursing home. And of course, we have the local ombudsman representative, where if you have an individual, family member, friend, spouse that's in a long-term care facility, they are the individuals who you can kind of speak with. They speak on behalf of the representative, kind of between the resident and the facility itself. So they're kind of a good middle person there to kind of help mitigate any issues. Some of the other programs that we have now, with this being said, there are probably several programs, grassroots programs across the state of Alabama, but these in particular are for our agencies. So just know that in your area, if you're not within our region, there may be some similar programs there that you might want to check into. But some of those include like the Panda Project, which we briefly mentioned at the beginning, which is a special grant program that we've received funding for to provide supportive services for individuals who have IDD or intellectual developmental disabilities, who may have a high risk or have a dementia-related diagnosis, as well as individuals without IDD who have a dementia-related diagnosis or high risk of developing a dementia-related diagnosis, and their caregivers. So it's a program that's kind of focused on the Shelby County region in the center part of the state, but it's been a great program. And of course, it's one of the co-sponsors of this Coffee Break initiative. We also have our Dementia Friendly Initiative, or Alabama Initiative, which is, in short, this is more headquartered out of the one of the Montgomery offices, but the state of Alabama is really a dementia-friendly state, in that each of our area agencies on aging have kind of a mission that we partner with first responders, law enforcement, fire departments, telecommunications, those sorts of agencies, to really try to bridge the gap between our services, their services, and those in the community that maybe we won't come in contact with quite as often, because typically when people are out of options, they usually call 911. And so really our initiative there is to kind of bridge the gap between us and them, as well as the clients, as well as kind of equip them with the tools for any type of encounters that they may have within the community of someone living with a dementia-related diagnosis. So we try to do our part to try to reduce any bad issues that may arise from maybe a misunderstanding of the situation. So we're really proud of that, and that's grown a lot over the last few years. We also have a Living Well Alabama initiative, which is also another grant made possible through an ACL grant, where we kind of give tools on healthy living, whether that be eating healthier, exercising, moving in general. And we're actually going to have them on next month for Coffee Break. So definitely stay tuned for that to kind of learn some health tips and tricks to make sure you live well. We also have a critical needs fund in our AIM community service project, which really go hand in hand, where we try to provide, if there's severe needs within the community, emergency funds are raised to kind of help provide a solution to maybe an emergent need. With the AIM project, it's more of a volunteer donation driven program to help provide, whether it be like wheelchair ramps or handrails, in short, home modifications to try to promote independent and healthy and safe living. We do, of course, have social media accounts. Our Facebook accounts are really our most popular. We have one for our Panda Project, Alabama Cares, our M4A, Living Well. Pretty much most of the programs here have their own, but we also have newsletters. We have a Twitter account for our agency. We have an Instagram that we post pictures and events on occasionally, but two of our biggest, of course, are our Facebook and our YouTube channel. This is currently being recorded. We are streaming it live on Facebook, but we do record these, kind of trim them up a little bit, and then put them on our YouTube channel so that we can then share them on our social media feeds, put them in our newsletters, and allow users, of course, to share them with their friends and family or individuals that they think may benefit from the content that we produce. When you go to our website, you will get a prompt to join our newsletter. We do encourage that. You don't have to be a client to join our general M4A newsletter, and it's full of content that goes out every week, whether that's, local information about events or national news or things that impact those that live within our communities. So definitely sign up for that. This is our contact information in particular. Again, we are in Alabaster. We're really between Alabaster and Calera in the Saginaw area on Highway 31 headed towards Calera. But we, again, cover all 5 counties kind of surrounding Jefferson County. So we are available. And if for some reason you contact our agency, we'll definitely get you connected with the agency that covers your area if you happen to not live within our region. Go ahead and mark your calendars. We do have the coffee break scheduled for next month. It is being labeled the exercise for everybody, and it's going to kind of focus on getting up, getting moving, living a healthier lifestyle, and that's going to be on April 28th from 1 to 2. And we do have the RSVP link. We will have that up on our Facebook page as an event pretty quick, so you can go ahead and kind of get registered for that, get RSVP. The best thing about that is Zoom will kind of give you a heads up on it coming up the day before, as well as if you sign up for it on Facebook, Facebook will let you know that it's coming up as well. So go ahead and get RSVP'd for that. And if you have any suggestions on content, we're doing these once a month. It's typically the last Wednesday of each month, barring any type of, bad weather or holidays or anything like that. But we definitely try to make accommodations the best we can if we can see ahead of time that that's going to be kind of an issue on that day. But if you have any suggestions, feel free to email those to panda@m4a.org. And I don't know if any of the other panelists, I don't see any more questions that have come through. Let's see. So we have a thank you here, and I see where Jennifer has posted the RSVP link to the next coffee break presentation. Outside of that, I think we've pretty much answered every question. And again, can't thank Amber and Jim enough. You guys brought great presentations today to our viewers, and we really appreciate it. And really thanks for continuing to shed light on such a serious topic that a lot of people really just don't think about.
Great.
Thank you.
Thanks so much.
No problem. And we hope that everyone stays safe, especially those in the central region. Seems like the weather changes every day here. I know that's pretty cliche for Alabama, but it's really the case for the central region. It goes from tornadoes to frost to to sunshine in a few days span. So everybody stay safe, and we will catch you next month on Coffee Break for session 21.